Dear viewers, a very warm welcome to today's format visit, and I thank you very much for your really numerous letters, notes, also a very kind praise. Thank you. And thank you for filling this format with so much life and for us to come together in such a beautiful exchange. I'll start right away with a question from Martha. Martha, you write to me about your husband and you write that you hear a lot about detoxification. Especially on YouTube with Dr. Klinghardt, with me, with Friederike, and you write that you also, or that in the context of these videos, there was described a lot of success in the amyotrophic lateral sclerosis of ALS, and you write very specifically your question, how far can an INUSpheresis be carried out here and with what success? That's the question. But then you write that you have now read that some patients didn't feel that well after this INUSpheresis, and we are now coming to your husband. The background would be that your life partner, I say your husband, was ill with ALS, and within 15 months he had 12 INUSpheresis. The dental foci was renovated, that is very, very important, but he has no improvement. And now, of course, the question is, every time the state worsens, then of course the question arises, is all of this so meaningful, what we are doing here? The doctor who treats him advises, clinically he tends to continue, but your life partner tends to let it go. And you are now looking for clues and would be grateful for an advice. And this advice is really not about you in particular, but it should be answered in general from my side. Because we must of course not forget that an ALS, also for the viewers who are not so familiar with this disease, is a motor neuron weakness. That means the nerve cells in the brain, of course, get instructions for work, and these instructions have to be translated now. These are fine-grained things, these are coarse-grained things, and if these motor neurons, i.e., those for movement, for rhythm, for the transmission of stimuli, for muscular activity, if these are all things that a person needs so that he can function and live in life, and these so-called motor neurons switch off, then of course there is a great, great loss of information. And it is a disease that has a very, very high degree of severity, and of course we are also observing here, and we are also accompanying a lot of patients who are getting sick from this disease. INUSpheresis is a possibility for a few years now, via a very specific environmental dialysis device. It is like a dialysis, like a blood wash, of course, to relieve the body of a great deal. And if we say today, also in terms of school medicine, we don't know why. Then I observe that we are no longer trying to approach the way back with the diagnosis of such a disease. A patient or a person who is now being notified of having a motor neuron deficiency is actually facing a very large learning situation in medicine, and the disease is estimated to be so severe and so serious that, in terms of school medicine, no therapy is available today. And that an INUSpheresis can relieve a high-quality neurotoxic environmental toxins, that is out of the question, that is what we are observing. It binds mercury, it binds arsenic, these are all high neurotoxins, which, of course, in knowledge, if a person is highly stressed, will have a certain relief here. On the other hand, there are thousands of toxins in our lives today. Everything that is in the refrigerator and has a shelf life is stress. We are talking about herbicides, we are talking about pesticides, we are talking about solvents, we are talking about formaldehyde, we are talking about bisphenol A, that is the softener in plastic, we are talking about glyphosate. All of this is a toxin, and it is always the summation of many things that, in the end, perhaps in the overburdening of the organism with all these things, support a disease development. I just want to say that it is not alone. We are certainly saying today that 70% are from the teeth and the jaw area, so it is a very good idea to think about this and all these disruptive fields, these toxic burdens, these amalgams, these dead teeth to remove, that is out of the question, that is important. But disease is always a multi-causal process. It is always a dynamic in a development that also depends on who I am. And we also know today that by miscontrolling, that is, perhaps by constantly holding on to things because I am a person who does not allow change, because I live in a disappointment that has not allowed reconciliation, because I may not be able to compensate for the loss of something, and thus my body has become permanently stressed for years and decades. That is important now, because that is very important, because I may not have processed this farewell of a life. This deep sadness, not having processed it, connects with information for my body. This weakens life functions. And if you do not understand this process now and at the latest now as a multi-causal event, and at this point I ask for forgiveness and also for an apology, if it may sound like an INUSpheresis clarifies all this, it cannot do that. Then there are things where you say here, if I do an INUSpheresis and see what happens there, like, for example, if I have breast implants that largely get these cracks and this highly toxic silicone is in the body and I see there it appears in the eluate, that is what comes out of the INUSpheresis and there it is clear now, then I see and then I feel it as a human being. Or when I observe things with the INUSpheresis, here I get forward. For example, I find it an incredible gift to do INUSpheresis, but when people only come to me for INUSpheresis, then I sometimes say, stop, we have to prepare you first. We have to understand why you is sick, and we have to recognize if the INUSpheresis and when it is well placed, because if all this is not important and here it is about very big questions, I have not yet spoken about viruses. There are neurotoxic viruses, there are retroviruses, there are hemophilic influenza, there are herpes viruses, there are Borrelia, there is the combination of Borrelia and toxoplasmosis. There is so much more. The human organism is a microorganism made up of bacteria, viruses, parasites, so-called endobionts, all microorganisms in the physiological form, live with us and work for us and fix for us and solve and build up. What do you think we have in the gut? A microbe world, which produces B vitamins, which produces vitamin B12 for us. That is all so important, that it has an equilibrium. Do I still have this balance? There is no patient with this disease, just as few as there are tumor patients or allergy patients, who do not have a disorder in his gut. Maybe he doesn't even tell me that he has problems there, but if we follow the thing, that is a criminal profession, the doctor's profession, then we get answers, and we doctors are trained to understand these connections, and we know what happens only if I have a B12 deficiency. This is one of the most important nerve vitamins. Now just take a pre-diabetes or metformin or a stomach protector, and you will slip into a vitamin B12 deficiency. But that is damn important for my blood formation, it is damn important for my neurotransmitter change, it is damn important for detoxification. Now I have toxins here, but I can't detoxify well myself. What is in the time from INUSpheresis 1 to INUSpheresis 2? That means this process, which is so complicated in between, must also contain a certain further concept that is based on you. I just wanted to say, per life partner, sorry, but I just want to say that it is not that easy. We think we relieve stress and we have everything under control. And I am asking for the signal that the body gives you, that it may still need help on a completely different level. And it is also incredibly important at this point that Dietrich Klinghardt has a huge team, which is also a study situation on the table, about the borreliosis, about the background neurodegeneration, about all the retroviruses. He has researched so much. And there are things that we already have in our hands today to know. I don't want to presume at all. This is a picture of a disease that is certainly also in the face of high toxic stress. To get worse. But maybe in the relief of this toxic stress, alarm clocks have to be set to see if other things are still playing a role. And if they are not cleared up now, then I think you should understand that this path has not yet brought what I should expect, if I invest so much time and effort and of course also take finances into my own hands. And here a rethinking must really happen for my terms. Because this disease demands incredible respect from us. I am also here in this short flash of time. I am also allowed to face this disease with a lot of respect and attention and know that it is not an easy path at all. And we have a clientele in front of us, which is of course very heavily burdened at the moment, even if they only pronounce the diagnosis. But all of this is something that should not be brought up now. Now you must not stop understanding it, and above all to recognize which further screws my organism needs help with. And I wish you from the bottom of my heart the strength and above all the gift to find a person in your environment who will really accompany you on this path. And I wish that such diseases will lose their horror in the future, as well as many, many others that we consider to be incredible today. But we also diagnose and treat everyone with the same medication. Without asking ourselves why and why it happened to me. And we have to make an effort, we doctors. And we all have to get this together now, because just looking at this and looking at that does not mean knowing these people. And this information can be provided to everyone, but it is to be seen, to be observed, because it is the disease of this person. And only in this way can we continue and maybe finally be able to handle certain things even better than we do in many other areas where we maybe just give the stamp and say that's the way it is, because it is the way it is, it will always stay that way. Yes, that was the answer to my question, Mrs. Martha. And finally, a very small nutritional tip for all those who are on the way, that they say not only every pound goes through the mouth, but I want to stay healthy, and nutrition is really a very big foundation. So it's not everything, but it's an important foundation. And the important foundation if you want to find your way out of the disease anyway. And it's actually just a very simple, grandmotherly advice that always said, the whiter the bread, the faster you are dead. And we are all aware of that wheat flour, and there are a lot of books, meanwhile the wheatwomp or stupid like bread, that again in a very large elaboration the topic of wheat flour, which is a extract flour, and of what the grain contains, B vitamins, essential amino acids and so on, which the wheat flour does not contain at all, but only the extract, i.e. the remaining, is contained in the wheat flour. And of course this has this excellent baking gymnastics, where I can do everything, the most beautiful yeast dough, the croissant that breaks down on the tongue, but it's like a addiction. You could eat one croissant after the other. These are all things with a lot of stuff, with a lot of list, and I can't get to the topic of glyphosate, but only the wheat has no nutritional value for our organism at all. And if you treat yourself lovingly, you see that the body can also benefit from a food, and it can't do all that anymore. Wheat is sugar, and the body doesn't care at all whether you eat wheat in the form of grain, a bun, a croissant, a light bread, or whether you consume sugar right away. Glucose appears in the blood, and it constantly needs insulin, 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 because a lot of glucose creates a lot of insulin. Now the sugar is sinking, and I need a croissant again, I need something sweet again. And this little bit creates insulin resistance, this little bit creates that we have diabetes with every second, third person, over 60, And if you don't want that, and if you say today, I don't want to be part of that, then try to think a little more about turning off this sugar bomb. I'm still deeply touched when I'm in a hotel, how many people put that on their plate, and that's why we repeat ourselves more often. But you can't say it often enough, because I decide what I eat, what I do, what I do, what I eat. And I hope it helps, in the long run, to give my body what it needs every day, and it doesn't need that. I can assure you of that again, in your body. It's also safe here, my dear good old Paracelsus. The dose makes the poison, but for many people it's just normal, and that's why I want to say it again at this point. The whiter the bread, the faster you are dead. It's a bit sarcastic, but there's a lot of truth in it. And in that sense, thank you very much for your attention today. Please let me know what you would like us to cover for this show. That would be Visite at QS24.TV. I'm very happy and thank you very much, and I'm looking forward to your letters, and above all, I'm very happy to see you again next time. In that sense, all the best, and see you then.